here, the CEO and founder of Elite Precision Consulting. We're the ones that have put this great summit together to help serve those who are essentially all over the world in healthcare, making an impact, whether on the clinical side or technical side. And so I want to introduce Suresh to you guys. Thank you so much for joining us today. And I can make you the host. That way, if you have anything you want to share, you can share that as well. So let me pass that over to you. And thank you so much, Suresh, for joining us.
Thank you, Sierra. Can you hear me? Can you hear me? Great. All right. Again, thank you, Sierra, for having me on your platform and giving me the opportunity to network with so many of your great speakers listening globally. It's my hope that this presentation that I'm going to give will serve as a wake-up call for all of us to help make this world a fairer place to be in terms of improving and providing affordable healthcare globally. There are tremendous things happening in healthcare, as we all know, in terms of your speakers. I mean, technology is accelerating everything, and for the benefit of mankind. It's going so fast that it's even hard to keep up with, And but whatever happens, right? The real message is that it should not be for the privileged few, as healthcare is a service to humanity, and therefore everyone, irrespective of color, race, religion, poor or rich, must be allowed to have access to healthcare services, no matter where they are and what the situation is. So before I go further, I'd just like to give you a quick brief on myself. We are a private limited company. We are not government affiliated, though we're confused, on and off with a government agency here in Malaysia that promotes Malaysia as a healthcare destination for medical tourism. We were launched in 2006 in Dubai, and we have built a brand in Malaysia healthcare. And it has been an interesting journey, but this journey has now come to a point where what you just mentioned, I mean, the reality of all these things happening around us has a severe impact on us. I mean, COVID has woken us up to the fact that nothing's for certain. Medical tourism has taken a huge hit because of this. 70% of Malaysia's revenue from tourism was hit because of COVID, and obviously medical tourism was too. And what happens if there's another variant? What do we do? What's the backup plan? We need to be steps ahead in terms of planning. And I, over this last since 2006, have been looking at obviously the services part of the business of healthcare in terms of medical tourism, but also the fact that technology is now accelerating a lot of things. You talk about AI, you talk about big data, you talk about all these technologies that your earlier speakers and future speakers will be talking on, will obviously impact the way we live in. But the reality is, as your earlier speaker from Indonesia, neighbor of ours, every country is going ahead trying to implement various plans in terms of providing for their people. Obviously, the richer countries, like when I was out west, in the US and in the UK and Europe, it's a lot easier when you're a richer country. When you're in a poorer country, it's a little more difficult. And this region of Asia has got 40% of the population of the world. So that's a huge amount. Yeah, and in fact, more than that, I think it's close to 60%. But the reality is, the wealth is in this region too. You find the wealthiest growth happening here in countries like India, China, and projected in Indonesia and other countries. So there is a wealth increase, and these people will demand for healthcare services of that level. So the days of flying to Mayo Clinic in the US or Cleveland Clinic, etc., may not be as often as they used to be. So that type of healthcare is expected to be here in Malaysia, here in this region. with the right expertise. And we are finding that many of our hospitals are JCI American accredited, MSQH Australian accredited. So they are of those standards, international standards. And a lot of the doctors who have trained, in fact, from Malaysian doctors have come back here and are working here. So we have quality. We have the equipment that you have, and you could probably get, treated for maybe 1/10 of what you would pay in the US. So the reality is there's a dichotomy in terms of, getting your care in this part of the world as well as in the West. Having said that, I am of the opinion that we need to move on. We need to move on in terms of technology, and we need to be able to integrate that into the systems that we have. The gentleman from Indonesia was talking about the plans of Indonesia. Malaysia has its own white paper that they're coming up with, and everybody does. And then you got the legal issues. How do you integrate all these systems? You talked about HIPAA compliance, in terms of, making sure that privacy, confidentiality is met. All these things are going to really, either slow things down or have an impact on, how it's going to be implemented. So I'm looking at things differently, and I just look at the challenges in the region where you got the geopolitical issues, America and China, and if you want to work in China, it's difficult because America doesn't like it, blah blah blah. The whole problem continues and becomes bigger and bigger. So the reality is the future challenges, there could be again another variant that might come around the corner. Are we prepared with a backup plan for that? In my opinion, we need to step back. We need to look at ourselves and we need to say, okay, where are we now? Where are we going to be in the next 20, 30, 40 years from now, right? And I look at the aging population as a big indicator of where we're headed. Whether we like it, Indonesia and maybe even Vietnam have a very young population, but they all have parents. And these people need to be looked after. We don't have the infrastructure here in Asia like you have it in the West. So there lies an opportunity to basically accelerate that. And that's what I'm looking at through Malaysia Healthcare on the private side, to do that. And why? Because on the government side, you're basically, you have the issues of political issues, and getting things passed is not as easy through the usual process of getting approvals through government. So it's better to do it where the innovation comes from, where does the creativity comes from. It comes from the private sector, and we have less issues to deal with, apart from getting approval and working with the government. So I feel, and we have actually embarked on this whole process where we need to look at self-sustaining. Being in the private sector, we need to self-sustain ourselves. So there must be a business model that works. So being in the private sector, it has to be bottom line driven, but it can be, and we have a model that works in terms of being able to do that. It's a hybrid model where you basically look at asset owning of land as well as building, but you have an overlay of services that comes in terms of healthcare. And this accelerates the whole process because there is a demand in this region. And here I'm calling out to organizations who are listening to this conversation that there is opportunity in this region. And language is a non-issue here. Most people speak English, though it is difficult in some countries. However, we are finding more and more it's much easier to actually do business in Asia. And I do believe that these technologies that a lot of these companies out west want to obviously benefit from would be in this region, because there is that interest in adoption. The negatives are basically, you are looking at where is healthcare going? Is it going to get more expensive? How are we going to afford? Will government be able to continue subsidizing its people? Medications are going up. The cost of medications, raw materials have gone up. This whole war that has happened, yeah, food has gone up. The price of food, inflation is all going up. So it'll impact healthcare. But what is truly happening right now? It's a priority. We can't avoid it. Healthcare is going to be a major industry, or if it isn't already. And if we don't take it seriously, and we don't have the resources to deliver it, people will suffer. So my idea is looking at aged care, but in a very controlled manner of managing aged care within an environment that has to be healthy too, because there's no point you being healthy, but in an environment where the planet's not healthy. So you need both sides to be there. And I have done this in the last 15 years. I've actually got a network of experts, partners to come in. And what you said earlier is what I think is my real challenge. How do I bring all these partners together? How do I get this done? And I think you relate that very well in terms of having a scope and being able to understand exactly and break it down into little pieces before you put the whole thing together. It's going to be a challenge. We intend to embark on this, and I've already seen interest. It's not just in Malaysia, but throughout the region. We've got interest even in Thailand, in Indonesia, in Cambodia, so Sri Lanka. There is a need for this. So I think, in my opinion, if you're going to have all these technologies that we were talking about, whether it's fintech, whether it's something to do with vaccines or whatever it is, you need to have it in an environment like this, where it can be proven, where it can be controlled, and it can be a success. So with that, I think, I don't want to take too much time, because I believe in collaboration, I believe in integration, and I believe in having an open mind. There is no, my biggest regret is there's always a difficulty of the government and the private sector seeing eye to eye. And it shouldn't be that way. It should be for the people first, and putting aside the egos and the political issues. It's looking at humanity and making that the priority. And hopefully I can do a small bit, and I'm looking out for people and partners. And I've already, just to give you an example, even developers, construction companies in this region, big companies from Korea, big companies from Japan, nursing companies who want to be involved with us, see this as a good project to be involved in. I'm looking for people who can add value to this. So I think all your speakers have been great so far, and I'm sure the others will be. But if they can also come in, and if they are interested to see where they can fit, there's no reason why we can't talk. With that, I think I'll just end there, if that's okay with you.
Yeah, we have a little bit of time, so I'm very into this conversation. So if you have more to share, that's absolutely fine, because we have some time. But yeah, I think so much of what you said is kind of why we're here. How do you bring everything together, and how do you bring it together when there's so many different other visions? People have their own way or vision of what they feel it should be to be quote unquote successful for the people. So it is a challenge, but it's necessary. And I think when you said, we need to look at the aging population, because that's kind of like where we're going, I think that's important. We do have a lot of technology. It can definitely benefit us, and it has, but it also can maybe hinder us a little bit as well. But I think everything that you said, I completely understand and agree with. And, even from the private sector and public sector, just seeing eye to eye, I don't know if that will ever happen. I will hope so, that we can get to that point and not use politics over people. But, there's a need, and the numbers that you had shared, that most of your population of Asia is there in Malaysia, it's crazy. So you have to have a viable solution to have good quality care, sustainable care. And I think it's just great that you are taking the initiative to do that, because it's absolutely essential. What I want to ask, and I have a couple of questions that are kind of coming in on this. Okay, perfect. A few questions here is, so when you're looking at kind of collaborating with different people to make this effective, to make this work, what do you think will be the biggest challenge in executing it? Do you believe it's having different visions? Do you believe that it's just the mindset or the model of each person and how they think is the best fit? Is it just actually coming together to one vision? What do you think is going to be the biggest challenge, kind of bringing in different people who, when you first talk to them, they agree it's needed, we love the idea, but then maybe when you get into it, it's kind of a little bit different. Now you're having to manage it a little bit more. So what do you think is going to be kind of the solution as you kind of embark on this?
I think it's a good question. It's a big challenge when you're talking about different cultures, yeah, and you're talking about in the private sector, within the MNCs, the multinational companies, they're set in their ways. And here you're talking about getting everyone to understand a certain vision, as you mentioned, and this is a vision, and how to execute it. Everyone buys into the idea, but how do you execute it?
Right.
I think from my perspective, I have my vision, but I'm open to other people's thoughts. I'm not saying I have all the answers, but I'm basically the ideator of this. But the reality is, I have to respect the fact that there are people who have been in their expertise and in their area long enough that may turn around and say some of the ideas that I have may not work or may not work so well, and why. So I think, I've actually planned 6 months of, and they tell me that may not be long enough to bring these consultants, if I can say, in. And these are international consultants, even from the point of medical planning to the design, to the organization, to the operators. You're talking about a huge group of people, but breaking them down into a smaller number so that we can actually come to some kind of conclusion. So there needs to be a blueprint that's going to probably evolve over this next 6 months or so that I can see. And it'll take a lot of meetings, a lot of thrashing out to get to the point that we know that this is where we're going to start. And I think we should not be delusional to think that things won't change. Things will change, and we must be able to accept it. Some suggestions may not be accepted, and we have to understand at the end of it all, we have to move. We can't get bogged down with with something and be sitting on this forever. So I think, to answer your question, the challenges I see can be managed in terms of breaking them down. The groups have to be identified, whether it comes into the actual development planning on the medical side of it, the prevention side of it, the actual technology side of it. All these areas have to be managed correctly with the right people. And then you have overall, you have the supreme management team, if I can say that, who basically look at this whole thing and see how this whole thing can be pulled together. It is daunting, to say the least. And some people turn around and say, is it going to be possible? But in the end, I'm paying the bills. I've got my partners. I've got people who believe in this, and I'm looking at partners who want to come into to still be part of it. And even, I'll be very honest, even the developers, the construction companies want to even take equity in this, because they want to be part of this journey, because this journey is not just Malaysia, it's throughout this region. And there can be a network of 100 or more of these all over the region. And now you are bringing people and you are basically giving them a chance to live a different lifestyle post-COVID. You are now living where you don't want to go to hospitals unless you're critical. You are now creating the the whole idea of prevention and healing people within your facility unless you really need to go to a hospital. And the hospitals we have in Malaysia are excellent. A lot of people see Malaysia as a destination, and for good reasons. And I can see where governments still have to do what they have to do. But I believe the private sector should be allowed to innovate and create these ideas and make it proof in the pudding that it does work. And I think it is very possible, as people are now reluctant to fly as they used to do because of COVID, and people are getting older too. They want, and they, as I said, they're richer here in this region. They can pay for these services. So why not create that environment to the specs that are world class, that people who can afford to will want to, be part of it. And that's my, a long answer to that question you asked.
Yeah. No, it's good. It's good. It's good. Great, great. Yeah. So another question they have here, you have a lot of experience in the healthcare field and over the years, and I think they probably saw your profile. So they're asking, where do you envision healthcare going in the next 10 years in Malaysia? Where do you see things going in the next 10 years?
Well, the next 10 years, technology, the advancements of technology, I see AI being the DNA of healthcare. It's in most industries already. And very quickly now, it's solving a lot of issues where, till now, many physicians have had to rely on trial and error in terms of medications. AI is already resolving that, in machine learning, and being able to scan in 40 million scans and be able to, identify very quickly what your, diagnosis is quite incredible. And what that will lead to when you talk about robotics, will people be moved around, by robots in hospitals? Will hospitals have to be rebuilt and redesigned? Would it be different in terms of the way they are now? Be more modular in terms of, providing services that are boutique-like. It's hard to tell, but what I can say is that it's going to be we can't do everything. We can't. What we can do is, and especially poorer countries, who don't have the resources that the wealthier countries have, is to try and minimize, the suffering of the people by giving them the best care that they can. Today, Malaysia the government of Malaysia subsidizes its people, and it's done an incredible job of doing it. But it's not going to be that easy anymore, because of the cost and the inflation that's going up, the cost of raw materials. How long can governments keep subsidizing? So there must be other ways to manage this. And one of the key ways, I think, in the white paper that our government is to look at prevention. And, and cities, you talk about, cardiac care, and you talk about, oncology and diabetes. Malaysia is one of the sickest countries per population in Asia. It's ridiculous, but we love food and we eat all the wrong food. So, but the reality is we need to look out, and it's going to cost the country more money if people are going to be sick, and that will also be in terms of, obviously, their productivity as tax-paying citizens. If they're sick, they're not going to be able to be productive. And secondly, obviously, if people are sick, it's not healthy at all, to the mind, the mental stress that people are going to have. And again, COVID should be a wake-up call for all of us. Life is not the same as it used to be, and we shouldn't fall back on that. We need to now step out and step up and do things, change things. A lot of people are saying that this idea it caters to healthcare, but it also talks about prevention care, and it also talks about the environment we're in. Our planet is sick. If our planet's sick, we will be sick. So what's the point of keeping ourselves sick if the planet's sick, you know? So, you know, we have to look at everything across the board. And if this little initiative that I'm looking at doing works on a smaller scale, then duplicating it across the world will not be difficult. I have seen interest as far as Africa. They say, why not? You know, we could do with this. And I've seen it even from Australia, even though they are so far advanced, they said, we don't have something like this. So I think this is something to think about seriously. And if people are interested in knowing more, please connect with me, because if they can add value, or, you know, in any possible way, I'd be very happy to listen and talk to them. Okay.
Awesome. Awesome, awesome, awesome. I love it. Thank you so much.